Good evening. My name is Chris Watson, and I'm a member here at St. John's Lutheran. I'm here to talk with and introduce our keynote speaker this evening and talk about Stronger Together, a conversation on men's mental health. For those of you that are watching online, welcome. Just a quick note that we will stop the streaming at the end of the keynote speech and before the panel discussion. So if you're watching this at a later date, you didn't miss anything. We stopped the recording. So I would like to introduce you to me. No. Whoops. All right, is our battery dead?
No, which one would you like to go to?
The first picture.
Okay.
I want to introduce you guys to this gentleman right here. His name is Kim Morris. He is a very good friend and mentor to me. Kim was born and raised in a small town in Texas. He went to Texas Tech University, where he graduated with a horticulture degree. He moved to Fort Worth, where he married his high school sweetheart and started a business in landscape architecture for commercial buildings. It was very, very successful. Kim's wife, Debbie, and Kim were incredible folks. They were so involved in their children's lives and in the church life of the family. They were a perfect couple. Kim and Debbie, they adopted two girls from South Korea. And when they adopted those girls, their lives changed, as you can imagine. And they were so involved with their children's lives. Kim was president of the Southwest High School PTA. He was president of the band Boosters. He was president of the dance team Boosters. And he served on the Athletic Boosters Executive Board. He was involved in the community, too. He was president of the Fort Worth Chamber of Commerce. That's a big deal. I was a member of the chamber. It's about 10,000 people, and he was president of that organization. He was president of the Fort Worth chapter of the Rotary Club, and he was an active member and president at St. Matthew's Lutheran Church, president twice. Kim, like most Texans, was an avid outdoorsman. He loved to hunt and fish, and he loved to ride his Harley in our neighborhood. And it was not unusual that every day after he got home from work that he would be riding around giving all the kids in the neighborhood a ride on the back of his Harley. He loved that. He was really looked at as a man's man, and he was given what I think is the most quintessential compliment if you're from Texas. He was Texas tough. Kim really had an incredible, amazing life. On Friday, January 22nd, 2010, Kim left work at 10 a.m. He drove to the cemetery where his parents were buried, and he took his life. And I can remember I was stunned, and I wanted to know why. But Texas Tough didn't leave a note. I guess we'll never know until I get a chance to meet him again. This really hit our church community hard. Kim's celebration of life at St. Matthew's Lutheran in Fort Worth, which is very similar in size to this church, seats about 200. We had 700 people there for his celebration of life. We had people packed everywhere. We had people that actually stayed outside the entire time and could not hear anything, could not really participate. And I was ushering, and I remember thinking to myself, I don't even think I know 700 people, much less have 700 people want to come to my funeral and pay me their respects. It's truly amazing. In response to Kim's death, St. Matthew's started they organized a men's group, and that was specific to men's health. We met monthly. We had about 60 to 65 people that came every month regularly. It was about 8 years when I left Texas that we had that. And we concentrated on the struggles and stressors that men face every day in their everyday life. We had speakers, and we also had small groups where we would get together and we would talk about the things that we were feeling. I really wish Kim had been there to participate in that. Because what we learned and what we were trained about was we didn't ask, how are you doing? We really got down deep and asked the questions because if you were asked today, how are you doing? I don't care if you were on fire, your car just went down the hill, you lost your job, you're going to say, that's right. So I really wish he would have been able to be part of that so I could have asked him those questions and gotten to the root of why he felt like he had to end his life. I also wish that Kim would have been able to be here for this particular event, and he would have had a chance to listen to Jamie Mulry, who is the executive director of the National Association of Mental Illness, the Dane County chapter, NAMI for short. I work, those of you, some may know and some may not know, I work at the Beacon downtown. I am the manager of guest services at the Beacon, which is a day homeless resource center. And NAMI is such an incredible partner with us in the work that we do on a day-to-day basis. They are absolutely amazing. I was really excited that I was going to get a chance to talk with Jamie and tell her, how much we enjoy her participation in the work that we do. So please join me in welcoming Jamie Mulray up front. Jamie?
Do you guys recognize the stained glass? I took it off the website. I was hoping somebody would notice, and Dave, of course, noticed, and so did Dana, so thank you. Welcome, everybody, to the Stronger Together presentation. I want to start off by just thanking Dana, who I've been working with directly, but I know that she has a team of people that she has been working with for putting this together. This is such an important topic. This is crucial, life-saving information, and we're just so happy to have the opportunity to share these things with our community. So thank you to you for all of your work, and then thank you for all of you for showing up. It's a Tuesday, the sun is finally out, but there's snacks, so that's good. Yeah, I just appreciate all of your time, and just know that we've got a lot of great information here today. We have a great panel that's going to be speaking as well, and we'll open it up for questions. So if you have questions or anything like that, you can save them till the end, but if there's something that strikes you that you want to raise your hand and ask a question while the presentation is going on, please do so. I would like, because chances are good if one person is thinking it, if you're thinking it, probably a couple other people are also wondering too. So please feel free to interrupt me. It's not a problem at all. And then I think that's it. Is it good to go? Okay, perfect. Okay, so this is the agenda for today. We're starting with a welcome. Then we will do a mental health overview, a men's mental health overview specifically. We'll talk about the stigma amongst men with mental health, which is really the reason that we address these things, because there is this stigma that exists, and it unfortunately causes people not to seek help sometimes when they need to. And the importance of men helping other men. So there'll be some good information on that. And then we will do some suicide awareness and prevention. And then afterwards, we'll take a big deep breath together, and we'll talk about self-care and how we can take care of ourselves, because that's important too. I do want to say before I get started that some of the topics that we talk about today can be a little bit heavy. They can be a little bit triggering. So if at any point in time you want to get up and give yourself a breather, walk around, have a drink of water, please do so. Please take care of yourself, check in with yourself, and make sure that you're in a good place, okay? All right, let's get started. My name is Jamie. I am the executive director at NAMI Dane County. I've been with the organization for almost 4 years, and I started as an operations manager, then moved into the role of associate director, and recently stepped into the role of executive director. Generally, in the role that I'm in, I wouldn't really be doing a whole lot of outreach and things like that, because we have a lot of staff that do outreach and things like that. But I really enjoy it, and I love coming to things like this, and it's just a task I will never give away, even if they try to make me. Okay, so just a really quick introduction into NAMI and who we are. So NAMI is the National Alliance for Mental Illness. We are the local affiliate, and fun fact, we are also the founding chapter of the entire nationwide organization. So 3 very angry moms, Bev, Nancy, and Harriet, with sons that had schizophrenia, got together in 1977 and said, we need to find help for our sons. We need to find help for ourselves. And there's nothing. And at that time, they were also blaming mothers for their children having mental illness, right? So they were mad, and they did something about it. They started a small support group that grew into a larger support group that grew into NAMI Wisconsin, and now it's a nationwide organization with affiliates across the country. So we really kind of have that as like a little feather in our cap at Dane County that we're the founding chapter. Because it's very grassroots, and Nancy is 91. She is still alive. We call her NAMI Mommy. She does Pilates twice a week, and she's very much still involved in the organization and comes to our events. And notably, her son Dylan, who has schizophrenia, just turned 70 in December. The reason that's important is because the life expectancy for individuals with schizophrenia is significantly lower because of the disease itself. So Dylan is a testament to what can happen if you support people in your community and you give them the resources they need and you love them the best that you can. In terms of the work that we do at NAMI, we have 3 main pillars that we go by to kind of keep ourselves, because mental health kind of affects everything. So we have 3 focus areas, so we can kind of keep our work focused in that way. So number 1 is education. What education looks like is this. This is education. What it also looks like is crisis intervention training. So we do the 40-hour training for law enforcement and basically train them for 40 hours on what it looks like to respond to a mental health crisis and make sure that we're not criminalizing mental illness and that we are getting people the resources they need. So that's a very, very important piece of things, because it's they don't do a whole lot of mental health training in the academy, so we come in and we do that. And we have done it for outside of Madison, we've done it for a lot of the other, Oregon police have attended our trainings. So yeah, it's really great. We do that training, and then we also do classes. So one of the biggest classes that we have, which is, again, back to the grassroots of families, is a family-to-family class, which is an 8-week course. All of our programming is free, and it basically says to families, hey, we understand that you need to put your oxygen mask on before you can put somebody else's oxygen mask on. And you need to fill your cup before you can help others. So it's families supporting families, because if you live with a mental illness or you love someone with a mental illness, you know that it can affect everybody around them or some people around them, and that support is necessary. So that's one of the classes that we have, and then we have other education and classes that we provide. And again, everything is free of charge, which is great, because at a time when people are losing access to their insurance, there's long wait lines for getting in to see mental health professionals, people come to us and they have a place to be, and there's no wait list. Oops, just kidding. Sorry. We also do support. So support looks like support groups. We have a adult, a young adult, a women's, an LGBTQIA+, and a family support group. And those support groups meet every other week, some virtual, some in person, and they're led by facilitators that have lived experience. The lived experience piece is big because it's a valuable thing that you can bring into a space. Sometimes if you go to a therapist, even if they've had a similar experience with you, they can't really share that, right? But when you've got a facilitator that's maybe walked a similar journey, they can share that with you, which also is a good lead into the fact that we have peer support specialists and parent peer support specialists that meet one-on-one with people and bring them into our office, or they meet them outside of the office, and they provide some of that one-on-one support. They describe it as we're there to walk beside you on your journey. So it's a really great service. And then finally, we have advocacy, which sometimes gets forgotten because it's not necessarily like attached to a program. But as we know from Nancy, who reminds us a lot, advocacy was the reason that they were able to move the needle back in 1977. They were at the state capitol. They were holding forums. They were doing all of those things. So we have an advocacy committee. We host forums. We host legislative listening sessions. We have a seat at the table when they are talking about budgets and budget cuts to mental health services and things like that. So we have a very robust advocacy, both at the local and the state and the national level. In November, I'll be going to DC to speak on the Hill and encourage our folks in DC to continue help funding the programs that help people with mental illness. Okay, now we can really go. Okay, I'm gonna take a quick drink of water. Okay, so what is mental illness? Mental illness is a condition that affects a person's thinking, feeling, and behavior. It can be something that's doesn't make an impact, or it can make a big impact on people's lives. And one of the things that we talk about is, it's like, well, everybody has mental health. Like, we all have mental health that we want to take care of. And that's an important point, because just because you don't have a mental illness, if you're not diagnosed with one or you don't have one, doesn't mean that your mental health in general is not important. So we like to point out that mental health has that place in the work that we do, because we want everybody to pay attention to how they're feeling and to reach out if they need anything. So the biggest, again, difference between mental health and mental illness is that we all have mental health, and some of us, myself included, have mental illness. So just a few quick mental health statistics, just to kind of put into perspective how common mental illness is. So 1 in 5 US adults will be diagnosed with a mental illness. So if you look around the room, 1 in 5 of us, theoretically, based on statistics, would have a mental illness annually. And then 1 in 20 US adults are diagnosed with a severe and persistent mental illness. We're going to talk a little bit more about what that is in a bit, but for reference, it's schizophrenia, bipolar, things like that. Half of the adults with mental illness received mental health treatment in the past year. And that's half, and that's not good enough for us. And that's a statistic that we take very seriously, and we continue to strive to boost that number up, right? And one thing that I wanted to point out as well is 50% of all lifetime mental illness begins by age 14 and 75% by age 24. The reason I share that is to point out the fact that starting conversations early about mental illness with younger people is imperative. Early interventions are a great way to get kiddos help early on when they need it. And then there's the men's mental health statistics. So 1 in 5 men will also experience mental illness in any given year. The most common is depression, anxiety, and substance use disorder, which we will talk about one by one in a few minutes. The suicide rate for men are 4 times more likely to die by suicide than women. And the reason for that is that men usually will choose more lethal ways to do that. And so, 4 times more likely, which is a lot. And it is the leading cause of death for men ages 15 to 34. And again, talked about the suicide rate is higher. Number one is the lethality of method, but another one is that men don't ask for help sometimes when they need it. I don't say that as a rule, I don't, but in general, it is harder for men to ask for help. It is a societal construct that tells you that you need to be tough and it's weak to ask for help. And so we're going to talk a little bit later about how we can reframe that and turn that vulnerability into strength. But that is the reason that statistic exists, and that's why we're here tonight. So, the most common types of mental illnesses in general with the population are anxiety, depression, eating disorders, and PTSD. Then there's severe and persistent mental illness. And again, this is a chronic condition that has a larger impact on people's lives. And those persistent mental illnesses are schizophrenia, bipolar, schizoaffective disorder, which is a mood disorder that also has components of schizophrenia with the visual hallucinations and things like that, and then psychosis. Psychosis itself is not a mental illness, but if people are in psychosis, they could be exhibiting signs of a more persistent and severe mental illness, such as, again, the hallucinations and things like that. So it's just something to be aware of. If someone is in a state like that, and a loved one shares, but they don't have a mental illness. They haven't been diagnosed with anything. Number one, that doesn't mean that they don't have one. But number two, it could mean that they're in psychosis, and it should be treated the exact same as a mental illness. So the most common types of mental illness in men is anxiety, depression, and substance use disorder. So we're going to talk a little bit about what each of those looks like and how we can recognize that in other people and also in ourselves, or yourselves. So anxiety disorder is characterized by excessive, persistent, and unrealistic worry. The way that I have anxiety disorder. I've been diagnosed with that's probably for about 15 years, but I probably should have been diagnosed 15 years before that. And once I actually started taking medication and getting help for myself, I was like, oh, this is how people feel when they, aren't always worried that something bad is going to happen or they're not having panic attacks. People are like, well, what does that feel like? Well, the way I describe it, and I hope that this is helpful, and you guys can use this if you'd like to, if anybody is ever asking, is what anxiety feels like to me is if I'm sitting on the couch, I got my feet up, I'm watching my favorite show, maybe I got a good candle burning, everything is very relaxing, but my body tells me that I'm being chased by a bear. That's what it feels like. It's fight or flight. And so it doesn't match up to the situation that I'm in. And for me, that's what anxiety feels like. That's not it for everybody, but that's how it manifests for me. Some of the ways that it can manifest are a lot of the things that also can be misconstrued as heart attack symptoms. So again, there's a whole way of just really checking in with yourself and checking in with your body and being aware of these things. And recognizing it in other people. If they come to you and they say, I worry a lot and, I get heart palpitations, I think I need to go to the doctor and, things like that. Yes, of course, it could be something physical, but it could also be something like anxiety that they can address in a different way because it is very treatable. So some of the thinking is the perseverating, the cyclical thinking, persistent worry about things that aren't really lining up again with reality. And then some of the physical, the way that it manifests physically is racing heartbeat, sweating, lack of sleep, too much sleep, things like that, where really it's, fully, for me, it's a fully physical, reaction that I have, and I can tell right away when it's happening. And again, I take medication, and it's very well managed. There's depression. So depression is a health condition characterized by persistent feelings of sadness. And I want to be really careful when I say that, because I want to be sure to point out that depression isn't just someone being sad, or people picture Eeyore, or somebody who's pessimistic or something like that. Depression is a very real mental illness, and to have somebody that is having those feelings kind of dismissed as though like, oh, they're just sad or they're just having a bad day. Those are dangerous myths that we want to try to stay away from. Depression is extremely treatable, but it can also cause really big issues in people's lives. The mental aspects of that, again, is persistent sadness, empty mood, feeling of hopelessness or pessimism, feelings of irritability and frustration, just in that general, again, sadness and that dark cloud. And the physical manifestation of that is the decreased energy, fatigue, feeling slowed down, difficulty sleeping. It can really affect your life a lot. So it's something to definitely be aware of, and it's very treatable. I also have that diagnosis, and medication really has helped me, and I really am glad. But it took a long time to get there. I would work with my doctors to try to figure out what it was. So it's important to start early. And then finally, substance use disorders. So this is a disorder that occurs when the recurrent problematic use of substances or activities and things like that are risky behaviors. So some of the substances that can fall underneath that: alcohol, of course, opiates, sedatives, stimulants, hallucinogenics, marijuana, and nicotine and tobacco. And then there's unique male symptoms, right? So we talked about all of those. That's kind of like an umbrella overview of what all of those illnesses can look like. But then enter these unique male symptoms that are an additional thing that we want to be aware of, and something because it just manifests differently in men than it does in women. So things to look for. It manifests as externalized behaviors rather than sadness sometimes. So it may not be somebody that's presenting as sad. It could be that they are irritable, they're angry, they have escapist behavior, which is taking risky chances with things, and emotional numbness, sleep issues, physical aches, all of those things. So if you're looking for the signs that somebody might have depression, in a male specifically, and you're like, well, but they seem like happy, like most of the time. They don't seem sad. They don't talk about being sad. They're very irritable, though, and they kind of have like a short fuse, and it kind of, doesn't really match up to the situation that we're in. It could be that they are presenting those unique male symptoms of depression. So we're going to talk a little bit about stigma amongst men. So they call this the silent crisis. And by that, it means that it's something that's just not talked about. Again, it's why we're here tonight, right? So the first one is the man-up myth, which is the societal expectations of being tough, of self-reliance, emotional suppression, really that prevents men from seeking help. Silence is a risk because 40% of men won't talk to anyone about their mental health, and 29% feel too embarrassed to do so. And breaking through that stigma is really, really difficult. We're conditioned in our society to have that be our norm, and we don't want that to be our norm. So again, we're confronting all of these stigmas in order to not only help ourselves, but help those around us. Everybody who's in here tonight is getting some really valuable information, and now you are ambassadors of all of the information that we shared. I also would like to share as well, some of the slides have a little bit smaller writing on it. And so I will be sharing these slides with Dana, and she can share it with everybody. So you'll have access to these. So if you know somebody who could benefit from this information, you can forward the PDF on to them, and then they can take a look at it as well. And I would also like to point out that if you work somewhere where you think this information would be helpful, or if you are in a different social group where you think this information would be helpful, we do these trainings all the time, and we really try to reach as many people as we can. So we hope and we thank people that are able to do that for us. So you're ambassadors now, okay? All right. the other thing with the stigma is the dangerous coping mechanisms. So men are more likely to use substances, as we talked about, as one of the most common mental illnesses, such as substances, drugs, things like that, engage in reckless driving, or exhibit anger rather than sadness, which oftentimes will mask those symptoms. But again, looking at those risky behaviors, specifically substance use and reckless driving and anger, which may result in some sort of situation where law enforcement gets involved. All of those things lead to this stigma really being responsible for people not getting help when they need to, people getting in bad situations when they don't need to. And unfortunately, sometimes this stigma can be fatal for men. And it's really something that we want to confront. So how do we redefine masculinity and find strength and vulnerability? So number one, we're going to try to shift the perspective a little bit. So how do we shift the perspective on this in order to kind of confront and dismantle those constructs that exist in our society? So we're looking at shifting it from, carrying this burden, this sadness, this, this anxiety, whatever it is, alone, to having the courage to ask for help. Because in the way that things currently are, being able to ask for help is courageous. It's courageous for everybody, right? Let's be clear. But for men, there's an extra hurdle there that exists. And reframing it as, you know what? I recognized I had a problem, and I took the initiative, and I fixed it. And it can be as simple as that. Now, I understand that sounds very simple. It doesn't always look like that, obviously. But that's the general idea, is to just, vulnerability can be strengths, and that's what we want to take from confronting, again, the stigma. The next one is vulnerability is not a weakness. So it's a skill. Sharing your emotions, sharing your fears, having these conversations, even coming tonight, right? It's brave. It's brave. You came here because you wanted to learn something. You came here because you felt that maybe there was some information missing in your life. You came here because there's someone you know that you're like, I feel like I might be able to help them, or that they might need help, and I want to learn how to do that. So it is brave for all of you to be here tonight. And I want to, again, thank you for that, because it's really easy to kind of go through the motions, but you guys are walking the walk and you're talking the talk. You want to make your lives better and the lives of others better, and that's really great. So you're doing all the right things. And then finally, we really want to reiterate the men helping men. And again, my ambassadors that are male in the room, we are looking at action-oriented problem solving rather than just emotional expression. And we want to be the ones that people can come to. Whenever somebody comes to me with a problem or an issue or anything like that, number one, my first instinct is to want to obviously help them. But my second instinct is to feel like, wow, I'm so glad that you felt comfortable coming to me. I'm glad that I can be a safe person for you, and that you know that you could bring something to my front door and that I'd be willing to help you. And I just encourage all of you to do what you can to also be that person for others. I'm going to take my quick drink. I don't know how you do it, Pastor Allen. This is... Check our time. We're at 7:07. Oh, perfect. Okay, we're good on time. Okay. So, what does men helping each other with mental health look like? Number one, it's choosing the right time and place, a comfortable private setting during a calm time, not in the midst of a lot of chaos and things like that. You want them to be able to be focused, and also to be in a space that's safe and private, right? Because these can be difficult conversations. The next one is to just let them know that you're a safe person and that you're willing to talk about mental health. The best way to let other people know that you are a safe person, number one is just to be kind. But number two is to share your own personal story, or, as Chris did, share a story of somebody. And really, because he was your friend, it also is your story, and to be able to share those stories with people. Because at that point, without saying, I'm a safe person, you're saying, I'm a safe person. You can talk to me, and I understand. The next one is starting the conversation. So just letting them know that maybe you've observed something, right? And not like in a creepy way, right? But in a way that says, hey, I care about you, and I have noticed that lately, you're just not interested in the same things that you're interested in. Or you're sleeping a lot, like a lot more than usual, or you've been really irritable, like out of nowhere, and it's a little bit alarming, and I'm not upset with you, but I want to, what's going on? I've noticed, and can I help? So it's really just kind of having those, what did my dad calls them, courageous conversations with people, and asking them directly, hey, I noticed this, let's talk about it. The next one is try asking twice. So much like Chris said, as soon as you told that story, I was like, I have a whole thing about that. When you ask, how are you? Many times the answer is, I'm fine, I'm good. But asking a second time, that's what the key is, because it's showing them that, number one, that you care, number two, that you're a safe person, and number three, that you kind of think that they're full of baloney, and that you see something that they might try to be hiding or try to be masking. And so once they realize that you see them, that can kind of take down defenses a little bit. It can also make people more defensive, and you navigate those situations as they come. But in general, it can ease that anxiety, and they're like, okay, a deep breath. You're a safe person.
Why are you saying that? And then it opens the conversation.
Exactly.
Because I'm seeing these things.
Yeah.
And you share some of your past experience, and it's always interesting to see people's reaction when you give your experience. And it's similar. Mm-hmm. And they look at you like, oh, I'm not alone. I'm not the only one doing this.
That is the NAMI motto, you are not alone. We have lots of bracelets that say you are not alone, that we hand out to people as a reminder, because you're not alone. And the way that you are able to get that message across is by telling your story. I was at a training all day today at the state capitol for the Sergeant at Arms office, and one of our presenters had a vulnerable moment in her presentation, and how she said, I can't believe I'm crying in public. But she did, right? She was feeling vulnerable, and she let her emotions happen, right? Afterwards, I walked her out, and one of the individuals who was in the training kind of came out and followed after her and just said, thank you. Thank you so much. I feel a lot of the same ways that you feel, and even though I know that other people obviously have to feel this way, I needed to see you tell your story. I needed to see your bravery to realize that I'm truly not alone. We may not be walking the exact same road, or may not be following in the exact same shoes, but we are on the same road. And that's very comforting for people. So that's just a little example of something that happened today, and I was like, I filed that one away because I want to share that with the group tonight. So asking twice, and then encouraging help-seeking behavior. So reiterating, help is not weak, and also frame getting help as strength. One big piece of all of that, though, is knowing how to help them, right? So you've recognized that there's an issue, you've asked them what's wrong, they've shared with you what's wrong. Now what? Will you say call a therapist? Right? Yes. And what are the other resources that exist in the community that can be helpful? And we will share resources at the end that NAMI has. I know that there's some other resources from BHRC, which is Behavioral Health Resource Center, that are out on the table, Tolarian, which is substance use disorder, and co-occurring as well with mental health, mental illness. And, but yeah, just having those tools ready to go when people need them. I didn't always work in mental health. I worked with the YMCA for 14 years before coming to, so my only experience with mental illness was just having one and having friends that had them and helping them navigate. But now I have all of this knowledge that I can share, and it feels like a superpower, right? Like it's a life-saving skill to have. And I'm hoping to pass that on to you, because it is really empowering. And it's pretty great. You can help people all the time and with like pretty low effort, right? Okay, so there's 5 action steps to help someone having thoughts of suicide. And we're gonna go through those. And again, some of them, as you're saying it, seem like, oh yeah, like that makes sense, yeah. But in the moment, it can be scary, right? And sometimes those sensible things in our head go completely out the window. So knowing what these things are and being able to revisit these steps is really, really great, and a way for you to be able to help others. So the first one is to ask. Asking the question, are you thinking about suicide, communicates that you're open to speaking about it. One of the most common myths and most harmful myths that exist is that by asking somebody, are you thinking about dying by suicide? Are you thinking about harming yourself? That by doing that, you're planting that seed into their head. And that makes sense, right? That is something that up until I started working at NAMI, I believed as well. That made sense in my head. Like, well, I don't want to suggest, power of suggestion. Like, I don't want to be responsible for that, right? But of course, we have science and we have studies and we have people that are much smarter than me who do a lot of work on this. And what they found is that it does quite the opposite. What it does is it just, again, I come back to this again, but it's kind of a good theme. It lets people know that you're a safe person to talk to. It lets them know, like, okay, you know enough about mental health or mental illness or, just the way that I am presenting, that you're asking that question, right? And that's a pretty big deal. But that's opening a door for them to speak. But that first ask can be a little bit scary. Again, those courageous conversations, right? But I'm hoping that once you have information like this and you have some resources, it will empower you to have this kind of conversation when you need to, because you will be armed with information and a deeper compassion for what people might be going through. Number 2, be there. This can mean being physically present or speaking with them on the phone, or showing up for them in other ways that they need for you to show up for them. This could look like, hey, can I watch your kids for you so that you can go to a NAMI adult support group tonight? Hey, like, I know that things have been rough, and when you're depressed, cleaning can be really, really hard. Like, when cooking can be really, really hard. Can I bring you a meal? Can I cut your lawn? Different ways that you can be there for people that are not necessarily having to be there like in a therapist type setting. Because we're not therapists, right? I mean, some of you maybe, I'm not sure who's in the room, but I'm not a therapist, but I am somebody who cares. And what I can't offer professional advice, but I can offer the power of showing up. And I kind of want you to keep that in the back of your head, the power of showing up. Keeping them safe. So reducing a person's access to highly lethal items is important. It's not easy, but asking if someone has a plan, removing things from their person can be a suggestion that you can make. A lot of people have firearms. That's the example that I'm going to use. And there are safety plans that exist where people, in programs that public health, for example, public health in Sauk County works with gun shops, where they will let people surrender their firearms and they'll store them safely for them if they don't feel safe having those firearms in the house at that time. I have a friend that did this. She had 2 or 3 firearms in her house. She recognized that she was in a place where she just did not want to leave that option open to her, and she asked a friend to come and pick up the firearms, and they created a safety plan. And so, again, that can be an awkward, right? An awkward conversation, but you could also save a life, Helping them connect. It's a really big, important piece of being there for them. Again, is getting them connected with, a family member that that can be of more service to them, or, again, the resources and things that we talked about, right? And then the last thing is to follow up. After you've connected with somebody and they're in a good place, you feel like you kind of can agree they're in a good place, let's follow up with them and see how they're doing. Because that question of how are you? How are you? How are you? You can never ask it enough, okay? There are lots of resources for suicide prevention. One of the best things that the Suicide Lifeline did was they took themselves from a 10-digit number down to a 3-digit number, 988. 988 is the number that you can call if you are having suicidal ideation, having thoughts of suicide. If somebody is, and you want assistance and you want help, and they're there if you need them. And they have, if anybody in here is a veteran, 988 has a special veterans line. So you dial 988 and then you dial 1, and that takes you to somebody who is specifically in a space to be able to provide resources specifically to veterans. They also have the option of texting, and they also have a live chat. I'm 42, so I'm not like Lucas. I'm not a Gen Zer, but I don't like talking on the phone. I just don't. It's just I don't like it. I would much rather text. And so to address that, they have the option of texting and also chatting for people that are more comfortable, because there are just some folks that even as much help as they would need, they would never pick up that phone. They just wouldn't. So. There's a crisis text line, 741-741. And then, again, if there's any vets in here, I do have some resources out there for veterans as well, specific to veteran suicide. But there is a Stop Soldier Suicide hotline as well. So there's a lot of resources out there. Again, having these in your back pocket is really, really important. We have Miami-Dade County resources, which are, this is actually a postcard that is out on the table. It's just blown up. And so these are all quick access crisis numbers that you can call. In your head, if you're in crisis, you're like, yes, I need to call Journey Mental Health. They have a 24-hour crisis line. But when you're in crisis, that doesn't always click, right? We are here to help. We've got all of these things in one place: alcohol and drugs, domestic violence, farmer support. I don't know if everybody knew this. Farmers were 4 times more likely to die by suicide than anybody else. And that is a whole other presentation that I would love to give if you guys are interested. But farmer mental health is something that we take very seriously too, because we work with the rural communities. But youth and family resources, public services, things like that. Can you guys all take a deep breath with me? That was a lot, right? That was pretty heavy. I'm gonna take another drink really quick. So we've been on a journey together, right? We've talked a lot about a lot of heavy stuff. And now, how do we take care of ourselves? Self-care is very, very important. It is proactive steps that you can take to preserve and improve your physical, mental, and emotional well-being. Different ways that can manifest are in a couple of different categories that you can kind of keep as you're trying to maybe check off some boxes and how you're taking care of yourself. Physical health, mental health, emotional health, and spiritual health. And it can be anything. For some people, it's going and having a full-blown spa day, right? But can't always do that, right? For some people, it is, for me, it's after my kiddo goes to bed, is sitting quietly and doing the New York Times crossword puzzle. I love that. It is the most calm part of my day when I'm not thinking about anything other than 12 across, right? But I'm intentional about that, right? I know that does that for me. And that's the thing, is with self-care is not just doing things that are maybe pamper you or make you happy or things like that. It's being really intentional. Like, I'm going into this because I am prioritizing myself and I'm taking care of myself. And just going into it with that intention is easier to bring it into practice. So these are the different types of self-care, and I encourage you to make a list for yourself and make it a bucket list. Check those things off. Find what brings you joy, what sparks joy, or just lets you kind of tune things out for a little bit, And some of our lives are just all over the place, and that can be difficult, but you're worth it. You need to invest in yourselves, okay? Okay, so again, this is my name and my email address. You can definitely feel free to get in contact with me. And then we also have that peer support that I told you about. So we have peer support, which is one-on-one with another peer support specialist. And then we also have parent peer support, which is peer support for individuals who have a child who has a mental illness. So for example, we have a partnership right now with Monona Grove High School where they refer people to us, and then our parent peer support specialist meets with a parent who has a child who's navigating the difficult road of mental illness. And it's, again, just someone that's there to walk beside you and help you. I think. Okay. I think the live feed, we're going to cut that off right now in preparation for our panel.